Hi everyone, Monica Moore, nurse practitioner at Fertility, and in this edition of Ask Monica, we are going to be talking about male factor infertility. It is important to talk about this because if it is a heterosexual couple, the male either is the sole source of or contributes to infertility and up to 50% of the time. And so it's really incredibly important when there is an infertility workup that the male gets evaluated early on. Because if there is a male infertility factor, we have to determine if it's mild, moderate, or severe based on the semen analysis results and a couple other things. And if it's close to the level of severity, then the female's treatment might depend on that, regardless of what the female partner has going on. So we don't always know the reason for male factor infertility. In fact, up to 30% of the time, we don't know the reason for it. There is often no necessary treatment for it. When a semen analysis is done, sperm that is produced is actually 2 to 3 months old. So if there are any lifestyle factor changes to be made, such as if someone is a heavy smoker, a heavy drinker, works with certain toxic substances, and that change is made, you will not expect that change to be reflected in the semen analysis until 2 to 3 months from then. So I want to show you a quick, using our board here, what we're looking for in the semen analysis. The first is the volume, or the amount of milliliters that is available in the semen analysis that is produced that day. Just an update semen analysis, or just to confirm, a semen analysis should be either produced in the office or if produced outside the office, needs to be in the office in a reasonable amount of time to keep the sperm at room temperature. For most places, it's somewhere between 45 minutes and an hour. The second factor we look for is the concentration. That is how many million sperm are there per milliliter. A question I often get asked is, why do we need so many sperm? So if we're talking about millions and millions of sperm and someone has only 4 million sperm, that seems like a lot, but it's not. And that's because a lot of sperm get lost in the process. When with regular intercourse and they're deposited in the vagina, you lose a lot in the acidic environment in the vagina, you use a lot at the level of the cervix. Then they have to get up to the fallopian tube where fertilization takes place. So although many, many millions of sperm are deposited, probably only 200 reach the fertilization site. So due to that huge attrition rate, we need to start off with a lot of sperm to begin with. So we look at the concentration, we look at the total motility of the sperm, we look at how many, in terms of morphology, look normal to us. If the morphology is low, it doesn't mean that the chromosomes are bad in the sperm. What it means is that the sperm may have what's called a defect that prohibits it from either getting to the egg or getting into the outer shell of the egg. The most important parameter in terms of the semen analysis is total motile sperm, which is a combination of the volume, concentration, and total motility. We never look at one parameter in and of itself and say this is quote unquote abnormal, but we look at these together, and if the total motile sperm is low and or the morphology is very low, that may guide our treatment and make our treatment a little bit different than if the semen analysis was normal. So we'll probably do a part 2 in this. It's a little bit of a complicated and nuanced infertility factor, but it is very important. So if I can leave you with one message today, it is make sure if you have a male partner, that male partner has a semen analysis and is analyzed very early on in your infertility workup. Thanks so much.